The White House is hoping to tackle health care ahead of 2020, starting with price transparency.
Our goal was to give patients the knowledge they need about the real price of health care services.
It works through a pair of new rules. The first is a proposal requiring insurers to provide consumers with online access to an estimate of what he or she would owe for a covered service, basically an explanation of benefits up front. The second rule gives hospitals until 2021 to begin posting their negotiated rates for services as well as their lowest cash prices in plain language that's easy to understand.
What happens now is that insurers and providers, doctors and hospitals, negotiate prices. And the prices are mostly kept secret. The only way we as consumers find out about healthcare prices is when we actually go to the hospital or go to the doctor and see those bills that come with explanations of benefits.
But now that the prices are open for all to see, that means the rates will go down, right? Maybe, maybe not.
You can tell a story in which hospitals are able to claw back discounts that they have given to insurers because the other hospitals, because hospitals can see what prices their competitors are charging. Or you can tell a story in which that enhanced visibility will empower insurers to negotiate better prices with other providers.
Consumers may not see those changes at all. Several hospitals are threatening lawsuits, claiming the rules violate their First Amendment rights. Regardless, Democrats say the White House's plan is too little, too late. Congressman Ro Khanna, who serves as the campaign co-chair for Senator Bernie Sanders, told Newsy Americans want real change.
The president saying, okay, the hospitals have to tell us how much they're charging. We already know they're charging an arm and a leg. I guess it's better that they tell us. But the real reform has to be that we have a single-payer system like Medicare that can drive down those costs, that can tell those hospitals, no, you can't charge this, we're not going to pay it.
But it was pretty clear from the MSNBC Washington Post debate, Democrats are also torn about how to tackle America's healthcare woes.
We don't have to tear down the system, but we do have to do what the American people want.
The fact is that right now, the vast majority of Democrats do not support Medicare for all.
It's no surprise the candidates and even members of Congress are divided when it comes to health care. So are Americans. According to a new poll from Kaiser Family Foundation, 53% of those surveyed support Medicare for all. 43% oppose it.
But movement on health care could prove pivotal for the president. The administration's earlier attempt at forcing drug makers to disclose their prices in advertisements is still caught up in the courts. And while Trump has dismantled key parts of the Affordable Care Act, he's been unable to overturn the law entirely. GOP Senator Mike Braun applauds the White House's new regulations, but says Republicans must lead the conversation or be outflanked by Democrats in 2020.
We were not recognizing healthcare as an issue. We were apologists for a broken industry. So we really do need to be attentive, but Republicans and conservatives are foot draggers, don't want change, and a lot of times just get outmaneuvered.